These are the steps that you have to take when doing a self-breast examination. They are very simple. First of all, stand in front of a mirror with your shirt off and bra off. Press your hands on the hips like this and observe before the mirror. Right now we are observing for the skin. Look at the skin, the appearance of the skin on both breasts. Is it normal? Look out for redness, for the dimpling that I talked about, that I mentioned in the signs, the orange peel-like appearance. Look for any stiffness, any abnormal shape and size of the breast. That is what we are looking out for at this point, plus the contour of the breast. The contours of the breast is this lower curve here. Try to observe critically if both breasts are at the same level. You may find that one contour is down here and then another one is up here. For women, it is normal to have one breast slightly bigger than the other, but all the same, these contours will always be at the same level. It still doesn't matter if you've breastfed, even if the breasts have sagged, still the contours are supposed to be at the same level. That doesn't change it even if you're breastfeeding. After this step, you slowly raise up your hands to your head. At this point, we are looking out for the speed at which the breasts are ascending. Like I mentioned, every woman has one breast slightly bigger than the other. Now, this is what helps us find out if one breast has a mass, and that is the reason for it being bigger than the other, or they are normal. If the breasts are normal, the breasts will ascend at the same time. But if one breast has a mass, when you do this, one breast is going to lag behind while the other is lifting itself up like this. Slowly. I am doing it fastly because it's a video, but you're supposed to do it slowly. Then to your head. Then the next thing, we are still going to bring down these hands slowly. What are we looking out for? Still, a breast with a mass will descend faster because now gravity is acting. So it is going to descend faster than this one. You'll be able to observe the difference. This one will reach its normal position while this one is still up. When you're lifting up the hands, this one reaches up faster, the heavier one, while this lighter one is still lower. So because the mass makes it heavy. So when you're descending like this, you still observe the speed at which all the breasts descend. Then after that, we proceed to our physical examination. That is when we are going to use these three parts. We use the three middle fingers. They are going to be the pad that we are using to examine the entire breast. Start with squeezing the nipple to check out for any discharges that are coming out of it. Like I said, it might be creamy or bloody or colorless. For breastfeeding mothers, of course, you're breastfeeding, so breast milk will come out. But if someone is not breastfeeding, we don't expect any discharge to come out of the breast. So if any discharge is observed, please note that down too. Lift up your hand like this. The breast tissue, we always think the breast is this swollen part, but breast tissue runs from below this bone. We call it the collarbone in simple terms. So right below it, this is all breast tissue, and we include the armpit itself. The armpit has three parts, and they all have lymph nodes. So the armpit has many lymph nodes, not one like we always see when we have injuries. So we are going to start from the nipple. It is better when you do it from a bathroom, there is soap, so the fingers can gently slide over the breast and you cannot miss out any masses. So you start from the nipple. Following, you can choose clockwise direction or anti-clockwise. So you can move like this with your three fingers. Make sure you cover the entire breast. I may be doing it first because it's a video. Then come to this part 2 up here. Palpate press for any masses. Then go to your armpit. All the parts of the armpit, there are 3 parts. You're supposed to make sure you examine them thoroughly for any swollen lymph nodes. Then after that, you need to lie down. Why do we lie down? Because still you need to examine for those masses that are you will be able to, that are on the chest wall, you'll be able to feel your chest wall when you're lying down. The breast will flatten, and it makes it easier for you to even trace out for those masses which you may miss out when you're in a standing up position. So you lay down, still follow the same procedure. From the nipple, move in a clockwise direction or anti-clockwise direction to make sure you cover all the tissue. Now, in case of any findings, I believe it comes with anxiety when you find anything, but the self-examination you're doing at home is not confirmatory. It is not the one that concludes that you have breast cancer. The breast will always have many masses which are not suggestive of breast cancer. That is where we Rocket Health come in, because you need to consult a doctor and tell them about your findings. You dial *280#, select one, and you will be able to, a doctor will call you back. He'll be able to explain all your findings to him or her, and they will be able to still explain everything in details for you. Where necessary, the doctor will have to invite you over to our clinic for a breast examination by the doctor themselves and other tests that may be necessary, so that we can have a final diagnosis for breast cancer. If it is in the early stages, if it is something else other than breast cancers, like I've mentioned, there are many different masses that may be found in the breasts that are not suggestive of breast cancer. Still, even if it's another type of mass, according to the doctor's examination, because each mass presents differently, the doctor will be able to give you the management that you need.